Hello, this is Dr. Maya, and today I will talk about neuroadrenal hormone test. And we have two tests, one for men, one for women, with a very small difference between them. But now first I will talk about overall test. So neuro stands for neurotransmitters, a state of your nervous system. Adrenal means your cortisol, and that is a product of your adrenal glands. And hormone is your sex hormone and your DHEAS. Why this test is important? Because it evaluates your HPA axis, hypothalamus, pituitary adrenal axis, and mostly when people complain about fatigue, adrenal fatigue, they are really talking about HPA dysregulation. This test is one of the key tests in evaluating a condition of your either hormone or your neurotransmitter or adrenal. And we can always do this test separately, so it can be 3 different tests. However, it provides much better result for your money when it's done all together. So let's take a look what it is. So this comprehensive test includes 4-point cortisol test to test for 3 stages of adrenal fatigue. The 4th stage is really Addison disease. We might catch it sometimes, but we are really targeting 3 stages of adrenal fatigue. And usually I get in the stages 2 or 3, which is either marked by anxiety or depression and total fatigue. Then we check complete hormone panel, which is a E1, estrogen, estradiol E2, estriol E3, progesterone, testosterone, and DHEA, as well as ratios, which are even more important than those separate hormones, because when you test separate hormones, you can see if they are low, if they are high, if you are taking hormone supplementation. However, they're not going to tell you what is most important, which is estrogen dominance. It's the ratio between estrogen and progesterone, and also a ratio between different estrogens, because E3 estriol is actually a protective estrogen in your body. So for men, we just exclude E1 and we test everything else, or exclude that E3. So and then neurotransmitters. Often people come to me just to check only neurotransmitters. We discuss, sometimes we just check basic neurotransmitter panel, sometimes we do all together. So what are neurotransmitters? It's your serotonin, dopamine, GABA, epinephrine, norepinephrine, glutamate, glycine, histamine, and phenethylamine, PEA. And each of these neurotransmitters, excitatory or inhibitory, are important for your mental state, anxiety, depression, insomnia, adrenal fatigue, your response to allergens, and also if you have ADD, ADHD, or any kind of attention deficit disorder, that even diagnosed or not diagnosed or self-diagnosed. So when we do this test all together, all 3 components together, it gives us a complete picture, and it gives you also a complete picture of what to do, because this test is practical. We can get you on a targeted amino acid therapy. We can look at ratios in your hormones, give your doctor who prescribes you hormones, if you have a hormone replacement therapy, best way to adjust them, and also different techniques and different herbal supplements for your recovery, for your energy recovery if you're suffering from fatigue. So this is in a nutshell this wonderful test. So let me know if you are interested in knowing more information about it, and I will see you later. Thank you. Bye-bye.